Welcome back to Uncovering Bailey and Love with Snazzy Surgeon. We're tackling a tough one today. Local breast carcinoma recurrence. It's something we all see, and knowing how to approach those first steps can make a real difference. When you're dealing with a suspected recurrence, where do you even begin?
Well, the absolute first thing is a biopsy. We got to be sure.
Yeah, of course, confirm the recurrence. But it's
Yeah.
more than just that, right?
Right, exactly. You got to remember the receptor status. It can actually change, from the primary tumor to the recurrence.
So the ER, the PR, the HER2, those can all shift.
Absolutely. Like that ER might have been positive before, but now it's negative. That completely changes our whole approach.
Makes sense. So the new profile, the new receptor status, that's kind of the foundation for everything that comes next.
Yeah, for all the systemic therapy decisions, it's essential.
Okay, so we've got the biopsy, got the updated receptor info. What's the next thing you're thinking about before you even consider anything local?
Metastatic workup. Got to make absolutely sure there's no distant disease.
Right, you don't want to be aggressive with local treatment only to find out it's spread.
Exactly.
So what does that workup usually look like for you? What's your imaging go-to?
I usually go for either a whole body MRI or a PT-CT.
Yeah, those seem to be the gold standard.
They give us the best chance of catching anything hidden, any occult metastatic disease. Before we even think about local treatment, we need to properly stage the patient from the very beginning.
Okay, so biopsy tells us about the local situation. Imaging gives us the big picture. So let's say it is a truly local recurrence, no signs of spread. How do you usually approach treatment then?
Typically, systemic chemotherapy comes first.
Makes sense. To catch any micrometastatic disease.
Exactly. Those cells that might have spread but are too small to see on the scans, we want to get those up front.
Okay, hit any potential hidden disease first. Then, once the systemic therapy is done, what's your usual surgical approach for the recurrence itself?
Surgical excision. That's the standard. A lot of times, especially if the recurrence is bigger or in multiple spots, mastectomy is the way to go.
Yeah, it's kind of the classic approach, good local control, especially in those situations. But, there's been more and more talk about breast-conserving surgery in these cases too, hasn't there?
Right. For some patients, carefully selected ones, a second BCS followed by re-radiation can be a real option.
Not for everybody, though, I imagine.
Definitely not.
So what kind of factors do you weigh when you're considering reirradiation after a second lumpectomy?
Patient selection is key. Things like where the recurrence is, how big it is, how long it's been since the first radiation, the total dose they got before,
Yeah.
and of course, what the patient wants. It's really a multidisciplinary decision.
Yeah, I got to consider all the angles.
You have to be sure you can get clear margins with the surgery and that re-irradiation can be done safely.
Okay, so to sum up the essentials for managing local recurrence, always rebiopsy to check that receptor status.
Absolutely.
Make sure there's no distant disease with the proper imaging.
Yeah.
Then systemic therapy first for potential micrometastases. And mastectomy is common, but reconservation with reirradiation is a possibility in specific, carefully chosen cases.
Exactly. Recognizing that receptor status can change and getting the staging right is crucial. Mastectomy gives you that definitive local control, but we got to keep in mind that second BCS might be an option for some patients, after a good multidisciplinary evaluation, of course.
This has been so helpful. Thanks for breaking it all down. It's a challenging area, but you've given us a really clear roadmap.
My pleasure. Glad it's helpful. I think keeping these things in mind, it helps us make the best choices for our patients when they're facing this.
Couldn't agree more. And to our listeners, thank you for tuning in to Uncovering Bailey and Love. We'll catch you next time.